Lower eyelid bags are a very, very common complaint that comes into my cosmetic clinic. Now, I think there are a few important concepts when we're talking about lower eyelid bags and rejuvenation of the lower eyelid and the cheek in general. And the most important concept to me is that of topography. Okay, so this is where the concept of the hill and the valley comes in. Oftentimes, a lower eyelid bag represents puffiness from orbital fat coming forward. And so, as that fat comes forward, it creates a hill. Now, hills are good at creating shadows, right? And so, the shadow from a significant hill can often leave you with a dark circle under your eye. To add insult to injury, as we age, we lose fat in our face and the fat pads start to descend. And so this together can lead to unveiling or exposure of some of the underlying bony anatomy. Now, the eye socket is a circular shape, and along the lower eyelid and cheek junction, you have the inferior orbital rim. As you lose fat and as the fat pads descend with age, this inferior orbital rim can become unveiled, giving you a valley. And so this provides kind of like the perfect storm, right? Because the local topography is that you have a hill immediately adjacent to a valley. Both of those on their own can lead to a shadow, giving you a dark circle. And together, they can give you an even more significant dark area that can lead to this tired appearance. So, evaluating the topography of the eyelid, the cheek, and how one blends to another, I think is really a key in understanding what we can achieve with lower eyelid surgery. Now, I will say briefly that sometimes when people talk about lower eyelid bags, they're actually not referring to the puffiness that occurs here. Rather, they're referring to some puffiness that happens over here. This puffiness in this region is different. That's referred to as a malar mound. Now, a malar mound is a totally different type of topographic issue. It's not excess fat, it's actually excess fluid. And so some people are more predisposed or prone to accumulating fluid in this area. This can be made worse if you've had things like fillers injected in the past, because what fillers do, especially as they partially break down, is they draw more water into the area, and that can make the appearance of malar mounds worse. It's really important that you identify what puffiness you're talking about when you're thinking about rejuvenating the lower eyelid and cheek junction, because the two are dealt with in very separate ways. So let's focus on the lower eyelid puffiness that's from fat coming forward from the eye socket. As I mentioned, it's kind of a perfect storm, right? Where you have this hill and the adjacent valley, but it's also the perfect opportunity because what you can do with a lower blepharoplasty is take the excess volume that's not helpful in the hill and use it to fill in the valley. And in my opinion, anyways, this can give you the most natural appearing smooth transition from the lower eyelid into the cheek and midface junction, which really is what we're trying to achieve with lower blepharoplasty surgery, reestablishing that beautiful smooth curve. Now, in addition to the concept of topography, the skin quality also needs to be taken into consideration. Any wrinkles that form when you're smiling or making an expression can be improved with things like botulinum toxin. Botox would be a brand example of this. But the other wrinkles that can involve the lower eyelid, the fine cross-hatched ones that are there no matter whether or not you're smiling or not, those need to be addressed by improving the skin quality. There's things that can be done at the same time as lower blepharoplasty surgery, like peels or lasers to help improve that skin quality, but it's really important to address. And sometimes, in addition to the skin quality, there actually is too much skin. You have a problem of quantity. And so, in these cases, removing a small amount of lower eyelid skin can be helpful. It is really, really important that this is done in a conservative manner because if too much skin is removed, it can pull the lower eyelid down. And so you have to be careful not to confuse the skin quality with the skin quantity, right? I usually use the analogy that if you had really wrinkled pants and you went to the tailor to hem them and they cut some material off, you wouldn't end up with more smooth pants. Your pants would just be too short. That's a big problem for the lower eyelid. So it's really important to identify quality versus quantity and to address them appropriately.